In this emergency decontamination operation course, we will focus on the full decontamination operation from the perspective of the Decon unit leader. The roles and responsibilities of the other Decon team members, as well as the actual process of performing decontamination, will be covered in other DQE on-demand courses. Every emergency decontamination operation, or EDO, should be an orderly and systematic process regardless of the incident or number of victims. A tiered approach to patient decontamination allows hospital first receivers to base the nature and level of decontamination on the type and extent of contamination encountered. In some cases, simply removing and containing the victim's outer clothing may be the only form of decontamination required for individuals exposed to hazardous vapors. In other circumstances, this form of self-decontamination with or without a body rinse may be the only first aid measure that can be performed prior to instituting more advanced life-saving procedures. Technical decontamination reduces a patient's contamination to a level that is as low as possible in order to minimize the potential for secondary contamination and ongoing harm. Once complete, hospital personnel can handle the patient in reduced personal protective equipment such as standard precautions attire. This is the more common type of decontamination procedure performed and typically includes the following steps. We will look at each step in detail throughout this course. The first step is recognizing the contaminated patient at triage or at other entrances of the hospital. Many contaminated individuals will report their situation at triage. Others may not recognize the connection between their symptoms and the contamination that they have experienced. The individual receiving the patient must be trained and able to recognize clues that indicate a hazardous substance may be present. These clues may be received from the patient in the form of description of injury or from their symptoms. Sensory clues such as odors or soaked clothing may also be present. Upon recognizing a potentially contaminated person, the staff member should immediately escort the patient outside to help mitigate cross-contamination of people or products. This must be done without increasing the risk of secondary contamination to the staff person or others. To do this, the staffer should try to stay upwind and at least 3 to 6 feet away from the patient while escorting them to the designated isolation area. The hospital's procedure for notifying the Decon unit leader should be followed. The hospital staffer should be able to gather some basic information from the patient about the event, but the Decon unit leader needs to conduct a thorough interview to help establish the degree of contamination, the agent's identification, and the patient's chief complaint. A full patient history is not necessary at this time. As soon as the degree of contamination and physical state of the contaminant are known and the need for emergency care established, the next steps can be implemented. The team leader should stay upwind and at least 3 to 6 feet away while talking with the patient and informing them about what to expect in the decontamination process and reassuring them that they will be properly cared for. If contamination is suspected or confirmed during the interview, the patient is instructed to remove and contain their clothing, at a minimum their outer clothing, in 2 layers of plastic bags. If there are multiple patients to decontaminate, including a triage tag number helps to identify specific clothing with specific individuals. Containing their clothing in this manner helps to limit any further off-gassing and reduce exposure risk to the patient and responders. Disrobing can usually be handled solely by the patient. If the patient is unable to remove their clothing but were brought in by a second party, that person may be able to assist in clothing removal, as they also will likely need to undergo some form of decontamination. For non-ambulatory patients or patients in extreme distress, the Decon team members should be prepared to quickly don PPE and cut the victim out of their clothing in a manner designed to minimize cross-contamination. Regardless of how the patient is disrobed, providing appropriate privacy and a sense of personal space contributes to the success of this most important step. After the patient disrobes, cover them with a sheet, blanket, or disposable gown until they are decontaminated. No physical contact between the unprotected employee and contaminated patient should occur. The next critical decision is determining if clothing removal alone is sufficient decontamination, or if more technical decontamination, such as a soap and water shower, is also required. A distinction needs to be made here between exposure and contamination. Click on each to discover the difference. If a shower is indicated, the Decon unit leader decides where it is safest to perform. The options usually include indoors in a domestic shower or outdoors in a portable decontamination system. Another option is inside in a permanent decontamination room if it is available. Make this decision quickly utilizing information gathered from the initial patient interview and from outside resources. Deciding where to decontaminate is relatively simple if positive identification of the substance is made. Based on the substance's physical and chemical properties, decide if there is potential for off-gassing or significant contamination to decontamination water runoff. This information is easily obtained from a safety datasheet, product label, WISER, shipping paper, or a call to the Regional Poison Control Center. Any substance that off-gasses or is toxic requires decontamination outdoors or in a suitable permanent decontamination room with appropriate ventilation. Substances that do not off-gas, are only minimally hazardous, and are safe for the local sewer may allow for the use of domestic showers such as those in staff locker rooms if available. Many household chemicals fall into this category. Any time a domestic shower is used, the patient must be able to stand on their own and be able to understand and follow directions. If the substance is not identified, a number of factors need to be considered when deciding where decontamination should be performed. The first is to determine if the individual is symptomatic from the exposure. The easiest way to assess this is through direct observation. If the victim is short of breath, coughing, or complaining of a burning sensation of their skin, it is reasonable to assume that the substance results in vapor that could off-gas or that it is toxic to some degree. In this case, the use of an outdoor shower or suitable permanent decon room is indicated. The decision on where to perform decontamination may also be influenced by the number of persons seeking care. Incidents resulting in larger numbers of victims should be managed outside where triage and decontamination can be more easily performed. Weather conditions can also play a role. At ambient temperatures between 32 and 65 degrees Fahrenheit, victims need to be quickly moved into a heated building following outdoor soap and water decontamination. If the ambient temperature drops below freezing, outdoor water decontamination may create serious safety hazards associated with ice formation. Under extreme weather conditions, remove and contain contaminated outer garments outside before quickly bringing patients inside for showering. Evacuation and isolation of the indoor decontamination area may need to occur in this case. After deciding to do soap and water showering, the Decon unit leader implements the hospital's procedure for alerting and assembling the Decon team. This also lets others in the hospital know that an emergency decontamination operation is underway. Available Decon team members should report to a designated area for the pre-incident briefing. As Decon team members arrive, the Decon unit leader must prioritize tasks and assign them to arriving members. In cases where the patient has arrived without any warning, the priorities will be equipment preparation and donning personal protective equipment. When advance warning of an incoming contaminated patient is available, chemical identification may be the priority. In multiple casualty incidents, securing the hospital and Decon area are two of the most important tasks. During the briefing, the Decon unit leader provides as much information as possible about the hazard, assigns roles and responsibilities, selects an appropriate level of personal protective equipment, and reviews the decontamination procedures. Suit support begins gathering the personal protective equipment in a designated suit donning area that is comfortable for designated responders and close to the decon area. Provide chairs to those donning PPE. The operations team who will actually perform decontamination begins pre-donning activities after their assignment is received. This includes removal of personal effects, drinking 12 to 16 ounces of clear liquids, and getting pre-response vital signs taken and recorded. As soon as suit support is ready for them, they should don their PPE and proceed to the decon area. Equipment support begins setting up the decon corridor in the configuration assigned by the decon unit leader. For a typical incident, this means a single shower for an ambulatory patient. Semi-ambulatory and non-ambulatory victims have special needs that impact the configuration of the decon corridor. The decon area setup course discusses the different setups required. Security restricts access to the decon area and ensures that privacy from onlookers is provided as much as possible to the patient. In multiple casualty incidents, this may involve further restrictions on access to the hospital. Security also directs ambulances or other arriving contaminated patients to the staging area. Additional roles and responsibilities are assigned to others depending upon the number of victims and staff available. Examples of additional positions include triage, safety officer, and traffic control. The decon unit leader also decides if outside resources, such as the fire department, regional response teams, or industrial remediation teams need to be contacted. For example, in instances where the contaminant is unknown, the fire department or hazmat team may be used to respond to the spill site to assist in product identification. If you anticipate using any outside agency during an emergency decontamination operation, include their role in the planning and training process and prearrange their emergency response objective. Once the decon area is set up, victims requiring a soap and water showering can be directed through the process. The decon unit leader instructs the patients from the cold end of the decon corridor in the proper showering method. This includes washing with a scrub brush from head to toe, being sure never to wash anything into the face. It is not uncommon for the decon area to be prepared before the operations team has completely donned their PPE. If that occurs, don't delay decontamination. Begin directing ambulatory victims through the decon process immediately. In many instances, only the decon unit leader interacts with the ambulatory patient as they instruct them through the corridor. The operations team is there for emergencies and support only. Ambulatory patients can shower themselves. Patients that need to be seated and those lying on backboards require much more assistance. The patient decontamination process course discusses these differences in detail. Once decon is complete, wrap the patient in a towel or blanket and hand them off to emergency department staff members for normal patient care. No one on the decon team should leave the hospital decontamination zone until the termination of the incident by the decon unit leader. The operations team makes sure the hospital decontamination zone is orderly with all contaminated clothing, personal items, and towels contained and placed within the confines of the area. They empty any pools used to capture decon runoff and secure equipment such as hoses, buckets, and drums. They should then perform self-decontamination, present to the doffing area, and begin removing their PPE with the assistance of suit support. Once PPE is doffed, the operations team enters the hospital for post-incident vital signs, debriefing, and showering. Equipment support should be sure all utilities are turned off and the wastewater collection containers are sealed and labeled before reporting for the debriefing. Once all patients are through the system, the suit support team sets up a doffing area at the exit end of the hospital decontamination zone and gets ready to assist the operations team in doffing their personal protective equipment. The purpose of the post-incident debriefing is to make all involved staff aware of signs and symptoms of exposure to the substance involved and to critique the response. Account for each team member and record all participants' names. Perform position-by-position reporting and give assignments to make training enhancements or rectify equipment issues. Record any supplies that were used and task someone with their replacement. Finally, the decon unit leader must officially terminate the emergency decontamination operation. The hospital decontamination zone must remain secured and isolated until it is fully cleaned either by hospital staff or a remediation firm. This does not need to be accomplished immediately, but should be handled in the same organized and professional manner as the emergency decontamination operation. Consider seeking reimbursement from a responsible party, if known, for equipment used and any remediation costs. In conclusion, not all emergency decontamination operations involve the same substance or the same number or type of patients, but they should all involve the same set of well-practiced procedures so that staff, facilities, and patients are protected to the greatest degree possible.